If you have plantar fasciitis, I'm sure one of the first considerations is, what have I done to cause this? Most of us will look at your most recent past to determine what may have initiated the onset. You might have attended a wedding and worn some very uncomfortable shoes. Or if you're a runner, you could have increased your mileage. Or maybe you went on a long hike in your flip-flops. Surely that was it. These are definitely events and activities that could have led to your PF. But often there are other overlooked precipitating factors or movement deficiencies that occurred before that particular event that led to the breakdown of the soft tissues and caused your PF. In this video, I want to dig deeper into 3 overlooked and surprising causes of PF and, of course, what to do about it. I'm Dr. Angela, and I'm the Plantar Fasciitis Doc, and I'm all about helping you resolve plantar fasciitis at home. Now, let's get into it. If you subscribe to my channel and have seen my other videos on plantar fasciitis, you are probably already familiar with my approach. Many people say that it is directly opposite of what they have been told to do. In my program, I focus on correcting any weakness or movement deficiencies in your feet and lower leg, which is the underlying cause, and not just managing symptoms. Unfortunately, most of the time, these deficits are not being addressed, and that is why recovery rates are so terrible with PF. I help people break free from the cycle of short-term fixes and focus on correcting the structural issues that led to your PF. Think of it like this. If you only patch up a leak in your faucet without fixing the plumbing, you're just waiting for the next leak to appear. The same goes for PF. Fix the system, not the symptoms. I have assessed thousands of cases, and these are 3 of the most common overlooked findings that I keep seeing over and over again in my patients. Number 1 is a misaligned hallux, which is your big toe. Number 2 is dysfunction of the posterior tibialis tendon, a tendon found in your lower leg. And number 3 is the presence of fascial adhesions. Now, let's dig into each one of these. Number 1 is a misaligned big toe. Our big toe is called the hallux, and many people don't realize that the position and mobility of your big toe could be keeping you from resolving your PF. Our feet should have a broad base and act as a tripod for proper balance and ankle strength. As we walk and run, our feet and toes should spread and splay. Our big toe should be straight and not shifted inward, and there should be adequate space between each toe. This allows our feet to function normally. When we wear footwear with narrow toe boxes, our feet begin to deform to the unnatural shape of those shoes. The majority of conventional footwear has toe boxes that squeeze your toes together and elevates the heel above the forefoot. This combination of damaging design features begins to alter the shape of your foot over time, and your big toe can start to shift inward. This deformity is called hallux valgus, and it's not only unsightly, it also leads to PF and many other foot conditions. The small muscles of our arch are called the intrinsic muscles, and I like to call them your foot core. It turns out that most everybody has a weak foot core, and it's almost entirely due to the compression of our big toe and other toes from wearing footwear that tapers at the toe. In fact, 90% of shoes have narrow toe boxes that restrict and alters the normal function and position of our feet and toes. We most often think about big toe misalignment associated with bunions, but it can also contribute to other conditions like neuromas, hammer toes, ankle sprains, and Achilles tendinopathy. Another compromising factor of malposition of the hallux is ankle instability. Our feet should be broadest at the base, the forefoot. If the toes begin to scrunch together, can't you see how this would affect balance and ankle stability? Our foot can no longer function as a tripod, and it can hinder balance, increase fall risk, and lead to ankle sprains. If you are prone to ankle sprains, you may want to take a look at your big toe position. Now that we know the importance of big toe position, let's talk about big toe mobility. To have an efficient walking gait, your big toe should have 60 to 65 degrees of dorsiflexion. If this range of motion is limited, it will have damaging effects all the way up the kinetic chain. Restoring your big toe to its natural anatomical position and improving mobility is one of the most powerful and effective ways to correct your foot problems and is essential for restoring normal arch support. I mentioned earlier that I would offer solutions and strategies to correct each of these three causes. The first obvious solution is to stop wearing shoes with narrow toe boxes. Your shoes should be widest at the toe and zero drop, which means no elevation of the heel. Your shoes should support the natural shape of your feet and allow normal toe splay. The shoe brands I recommend most often are Ultras, Limbs, Zero Shoes, and Flux Footwear. I have an approved shoe list that includes footwear that meets the criteria for natural foot-positive brands that I approve and recommend. Just put the word shoes in the comments and I will be sure to get you a copy of that. Want to know the best way to see if your shoes are wide enough at the toe? Take the insole out of a pair of your shoes, some that you wear most often. Place it on the floor and stand on it. If any part of your foot or toes extend over the insert, those shoes are not allowing your feet to function normally and are contributing to your plantar fasciitis. The second solution is to walk barefoot with toe spacers. I'm sure you've heard to never walk barefoot if you have plantar fasciitis, but barefoot walking is one of the healthiest things you can do for your feet, and it naturally strengthens your foot core. If you are in the acute phase of PF where you're in a lot of pain, it can be painful to even think about going barefoot, but the benefits are numerous. It takes time to train your feet to enjoy barefoot walking. You will need to slowly begin to introduce your feet to this new concept. Barefoot walking allows your feet, then the toes, the total freedom to spread and splay and begin to activate and recruit your weak foot muscles. Adding toe spacers helps to stretch and realign your toes, helps to restore big toe position, helps to encourage natural arch support, and they also help to broaden the base of the foot to improve balance. I believe toe spacers are one of the most powerful tools for restoring optimum foot health. Wearing toe spacers is like putting braces on your teeth. If you wear your toe spacers while exercising, walking, and inside your wide toe box shoes, it further enhances the corrective benefits. I recommend starting with going barefoot with toe spacers for just a few minutes a day and increasing the time each week. Set a goal to walk barefoot 2 hours a day. The second primary cause of plantar fasciitis is posterior tibial tendon dysfunction, PTTD. The post-tib tendon originates in the lower leg and wraps under the arch. It attaches to the navicular bone. It is an incredibly important tendon for healthy foot function. It is a primary stabilizer of a medial arch, and the strength of this tendon is essential for controlling pronation. If it is weak or not functioning properly, you will likely see a flattening of your arch and experience pain on the inside of your arch and into your ankle. Because of the location of symptoms, it is often misdiagnosed as plantar fasciitis. The primary cause of dysfunction of the PTT is excessive overpronation. This is most likely due to tight calf muscles. Let me explain. When our calf muscle group is tight, it limits ankle dorsiflexion. When our ankle mobility is restricted, it forces our arches to collapse and encourages overpronation. Repeated foot overpronation, arch dropping, produces tendinitis of the posterior tib. So, how do you tell if your arch pain is PTTD or plantar fasciitis? These two diagnoses present with many of the same symptoms and have many similarities. Although there is some overlap, there are several important differences. The pain with PTTD is often higher up or along the inside aspect of the ankle. PF is often more pronounced at the bottom of the surface of the foot, closer to the heel. A hallmark sign of PTTD is decreased endurance and strength when performing single leg heel raises. Being able to stand on one leg and come up on your tiptoes requires a healthy posterior tibialis tendon. With plantar fasciitis, the most common characteristic is pain with the first few steps in the morning or after a period of rest. As far as the cause or source, both of these conditions result from too much load on the foot. In either case, the treatment plan can be very similar. We must focus on restoring both foot strength and tendon strength with progressive loading. Progressive loading is defined as the gradual increase of resistance and load during an exercise. The solution and strategies are 3 exercises. The exercises are to be done in this order as they progressively load the tendon. The first exercise is calf raises with a ball between your heels. By squeezing a ball, you are isolating the PTT. The second exercise is calf raises on a slant board. Progressing to performing the calf raises with a ball on a slant board increases the load and further increases strength. The third exercise is single leg calf raises. As I mentioned earlier, tendons respond well to progressive loading, and single leg calf raises is the next step in increasing tension on the tendon. Perform one set of 12 to 15 reps of each of these exercises one time per day. The third overlooked cause of PF is the presence of fascial adhesions. Fascia is the connective tissue that wraps and surrounds every single thing inside of our body, including our muscles and other soft tissues. When your fascia is healthy, we are able to stretch and move fully. When it is unhealthy, it's rigid, inflexible, and very painful. Most people with PF have unhealthy, restricted fascia in their feet and calf muscles, and this can be the primary cause of your PF symptoms. Addressing fascial restrictions is step number 5 in my PF recovery program, and it's one of the most critical steps. Our fascia should freely glide without sticking or adhering together. Adhesions form when the load placed on the body is greater than the capacity of the body's tissues to handle that load. In other words, if you put more stress on the tissues than it can handle, the response is a breakdown of that tissue and adhesions develop. Many people skip this important step in improving mobility. In fact, your stretching efforts will virtually be ineffective if you are not clearing out fascial adhesions from the soft tissues before you stretch. The way that we release these adhesions is with targeted strokes using a specific tool that helps us locate and identify the adhesions. Fascial release is also called muscle scraping or fascial scraping. So your solution is to use a fascial release tool to release bound up tissues in the gastrocnemius, the soleus, the Achilles tendon, the posterior tibialis, and the plantar fascia every 2 days. The muscle scraping tool has a beveled edge that is specifically designed to help you locate adhesions. You will sense a vibration when you scrape across an adhesion. When fascial release is used properly and consistently, you feel noticeable instant relief, and your flexibility, mobility, and pain intensity improves significantly. I have a full demonstration on how to release fascial adhesions for those with PF in my free guide. Put the word guide in the comments below, and I will send the link right over to you. If you want to get started fixing the system and not just the symptoms, be sure you watch my next video on more strategies to resolve your PF. See you in the next one. Keep watching.